Hi students, I hope you are all good and doing well in your studies. Today you gonna learn about prothrombin time. Firstly, let's learn why PT test is performed. Prothrombin time is commonly used for screening for extrinsic factor deficiencies. I hope you know about extrinsic factors. And it is also used for monitoring oral anticoagulant therapy. Means the patient is taking blood thinning medicines. Let's learn what are extrinsic factors. In last lecture of coagulation cascade, easy way to remember, we have discussed in detail about 3 coagulation pathways with tricks to remember. If you want to remember the clotting factors, watch my last video. In this lecture, we will only discuss about extrinsic factors or extrinsic pathway because prothrombin time is used for screening extrinsic factors deficiency. It includes factor 7 that is include in the extrinsic factor, factor 10, factor 5, factor 2, factor 1. To remember these factors, learn 5 multiply by 2 multiply by 1 is equal to 10. 1, 2, 3, 4 and 5. 5 factors. 7, 5, 2, 1 and 10. So if the patient have prolonged PT time, it means that it may have deficiency of factor 7, 5, 2, 1 and 10. Now let's learn the principle of prothrombin time. When a mixture of tissue thromboplastin and calcium ions are added to normal anticoagulant plasma. Plasma is our sample, our patient plasma, and prothrombin plastin and calcium ions are present in PT reagent. So, as you know, prothrombin plastin and calcium ions are clotting factors. So, when these clotting factors are added in the plasma, the clotting mechanism is initiated and the clot is formed within a specified time period. The degree of prolongation is proportional to the severity of clotting factor deficiency. So, if PT time is prolonged, it means there is deficiency of clotting factors. Materials: PT reagent that contains thromboplastin and calcium ions, plasma sample that is of patient, stopwatch to measure the time of clot, water bath, procedure: bring all reagents, control and sample to room temperature 15 minutes prior to testing. Pipette 100 microliter of PT reagent in each tube. As for example, this is a tube. Add 100 microliter of PT reagent and place it in water bath to pre-warm PT reagent at 37 degrees centigrade for 5 minutes. After 5 minutes, add 50 microliter of plasma and start stopwatch. Mix in water bath for 8 seconds. Then record the time required for clot formation. The normal range of PT is 11 to 16 seconds. Prolonged PT. Now let's learn the reasons of prolonged PT. A prolonged PT means that the blood is taking too long to form a clot. The reasons are liver disease. As you know, liver makes blood clotting proteins. If liver is damaged, it will not able to make right amount of blood clotting proteins. That's why the clotting process takes longer. The other reason is treatment with oral anticoagulant drugs, means that the person is taking blood thinning medicines. The third reason is deficiency of factors 7, 5, 2, 1 and 10. If the patient have deficiency of clotting factors are the factors that make clot. So if there is deficiency of clotting factors, the clot will not form. That's why the blood take too long to form a clot. Vitamin K deficiency. Vitamin K is needed to make clotting factors. So if your PT is prolonged, it means that patient have deficiency of vitamin K. So that's all about prothrombin time. If you want these slides, you can get a link in the description box. Thanks for watching. Leave a comment and don't forget to like, share and subscribe my channel for more lectures. Thank you.